So we're going to talk about prostaglandin analogs. These are the most popular glaucoma medications because they're the most effective. They have the least frequent dosing. They're used once a day. And generally, they're very well tolerated. The precise mechanism is not known, but it appears that they increase uveoscleral or non-conventional outflow. So they increase flow through the face of the ciliary body, ultimately into the suprachoroidal space. They decrease intraocular pressure by about 25 to 30%. So there's really no single agent that does a better job of lowering intraocular pressure. And they're indicated for all forms of open-angle glaucoma. They're not tremendously effective in primary congenital glaucoma or in angle closure glaucoma because, of course, in angle closure, the iris is not only covering the trabecular meshwork, it's also covering the ciliary body face. There's some issues with using it in inflammatory glaucoma, but I think over time we realize that mostly people with inflammatory glaucomas do pretty well with these prostaglandin analogs. And it is associated with cystoid macular edema in patients who are pseudophakic and aphakic, and so they would not be ideal candidates. Some interesting side effects: you can get iris pigmentation, as you can see here in this patient's right eye, in up to a third of patients, although I don't really feel like I see it that commonly, or at least the patients don't recognize it that commonly. Obviously, you don't see that in really, really brown irises because they're already fully brown, and you don't see it very often in eyes that are really light blue, but more in hazel or green-brown eyes. You can also get periocular skin pigmentation, and that's caused in both situations by increased melanosomes. So you don't have more melanocytes, there are no more cells, just more melanosomes within the melanocytes. There's no evidence that there's an increased risk of developing melanoma or other pigmentary tumors. You can get long lashes, and that is very common, as seen here. And in the slide on the left, sometimes these lashes are a bit unusual and unattractive, and they're really obvious, as you can see on the slide on the right, in people who are using these prostaglandin analogs in only one eye. And sometimes people take them in the fellow eye just to keep the eyelash length similar in both eyes. Something that's recently recognized, and like a lot of things, once you recognize it, you sort of see it everywhere, is this prostaglandin-associated periorbitopathy, where one gets this very deep-set eye, this very deep furrow above the upper lid. It's like the long lashes, a lot easier to see in people who are using it unilaterally. This patient has both the orbitopathy and the long lashes on the left side. This is a young woman who was in an auto accident, had glaucoma only in her left eye, and you can see that she developed this orbitopathy, and she sort of assumed it was from her trauma, but after she had a drainage tube implant and stopped her prostaglandin analog, this completely went away. One can get cystoid macular edema in eyes that are aphakic or pseudophakic, and it can reactivate herpes keratitis. In the U.S., there are 4 forms of prostaglandin analogs. Latanoprost or Zalatan was the first. The differences between them are somewhat slight. Latanoprost is perhaps somewhat less effective than bimatoprost or Lumigan, but has fewer side effects. Travoprost, Travatan Z, really is almost identical to latanoprost. It has a different preservative that might be useful in somebody who is allergic to benzalkonium chloride. And then tafloprost or Zioptan is a preservative-free prostaglandin analog. These are all used at night. Using it more than once a day paradoxically increases the pressure, so there's no advantage to going to twice a day. So these are the most potent pressure-lowering agents that we have for routine use. They're given in the evening. They are generally well tolerated. And the side effects are mostly ocular. And some, like the periorbital atrophy, are reversible. Good to know about prostaglandin analogs. They are the medicines that you'll probably reach for first for most patients with glaucoma.